Hello, friends. Last time we discussed how we can enhance the healing of the wound. So, this time I will talk about what are the various factors that can cause or that can affect the healing of the wound, and what are the various factors that can cause delayed wound healing. So, factors that can affect the wound healing, these are the number one is infection that is present in the wound. If infection is present, the wound may heal slowly or may not heal if persistent infection is there. Second are the foreign bodies. So these foreign bodies can be introduced into the body in a road traffic accident, or it could be a suture material or something else that has been left during surgery or during the debridement of the wound. That may be small thread of the gauze piece or cotton thread. So that will not allow the wound to heal until unless we remove that thread of the gauze piece or the cotton. Then the necrotic tissue present in the wound. So as long as the necrotic tissue is present, so what will happen? From both sides there will be no reaching of raw material for the proper healing of the wound. That means blood circulation is just at the margins of the wound, but it is not going beyond the necrotic material. That means the cells which can cause the phagocytosis, the proteins, the minerals, the vitamins, all these raw materials which are essential for the healing of the wound will not reach to the site of the wound. So we have to remove all the necrotic material till the margins are bleeding profusely. So at that stage we have to stop and pack the wound, let the bleeding stop by own method or by its own. Then are the tissue edema and the tissue tension. Suppose there is a wound around some joint or something we have sutured, or because of severe edema there is non-healing or delayed healing of the wound. Why? Because when there is sutured wound, in that case suture they cause the strangulating effect on the blood vessels or the capillaries which are present at the margin of the wound. So that will not allow the raw material reaching to the site of the wound, so that will cause the delayed healing of the wound. Similarly, if because of any cause edema is present, that edema will also cause increase in the tension in the tissue material. So what will happen? There will be constricting effect on the capillaries which are going into the margins of the wound. So that means this will also hamper the raw material for the healing of the wound to reach at the site of the wound. So what are the various factors that can cause delayed wound healing? Number one is the advanced stage. So in advanced stage there are many factors that play a role. Because of aging process there may be decreased vascularity to the affected part. So that decreased vascularity means there will be decreased oxygenation of the tissue at the site of the wound. There will be decreased level of proteins, minerals, vitamins, all these things which are required for healthy healing and quick healing of the wound will not be reaching in a proper quantity. So that will cause the delayed healing. Other factors, because of your other factors like deficiency of the proteins, deficiency of the minerals, vitamins, because these elderly people have decreased appetite, or because of many factors they are not able to consume the required amount of diet that is required by the body. So that will also cause delayed wound healing. Other factors, the decreased immunity of the body, that can also cause decreased or delayed wound healing. So what are the other factors I have already discussed, like the nutritional deficiencies? So what are those nutritional deficiencies that can cause the delayed wound healing? Vitamin C, that is required for the maturation of the collagen. Vitamin K, hypoproteinemia. Hypoproteinemia will cause either your decreased formation of the collagen or low quality protein. If present in the body, there will be low quality collagen will be formed, and that will also cause delayed wound healing. Then is the zinc. Zinc is required for the maturation of the premature collagen to the mature collagen, and if zinc is deficient, that will cause less amount of mature collagen formation in the wound. So that will cause the delayed healing of the wound. Then is the chronic steroid therapy. So steroid plays like a multi-pronged effect on the healing of the wound. So they cause the decreased immunity. They also cause other factors that lead on to decreased healing of the wound. So these are the steroids are basically the stress hormones. They create a stress response in the body, that is, they can increase the blood sugar level, they can decrease the immunity, and they can cause other factors that lead on to delayed wound healing. Then is the diabetes mellitus. So diabetes mellitus also plays in a multifactorial way. So increased blood sugar level and the increased sugar level at the site of the wound plays a critical role by acting as a good culture medium along with the debris and the tissue fluids. Chronic diabetes can also lead on to the decreased vascular supply to the area of the wound because of your deposition of the plaques in the vessels. So that can also affect the raw material reaching at the site of the wound for the proper healing of the wound. Third is the neuropathies. So these neuropathies also plays very important role in the delayed wound healing, because as we know, pain is a very important protective mechanism that the nature has given to us. So in case of neuropathies, we will not be able to appreciate the pain with minor injuries, and ultimately we will keep on neglecting the minor injuries, and ultimately that will cause delayed wound healing, because we have no feeling of the wound, no pain, nothing. So we will not be able to appreciate the depth of the wound and the problems associated with the wound. Then are the malignant diseases. These malignant diseases also play multifactorial role. They decrease the immunity. They produce many factors like tumor necrosis factors and other interleukins which cause delayed wound healing. Third is, these patients with malignant diseases may be undergoing chemotherapy or the radiotherapy, and these all drugs are cytotoxic drugs. Similarly, radiotherapy is also acting as a toxic or damaging effect over the immune cells and the other cellular elements which deposit the matrix and cause the phagocytosis. And this radiotherapy can also cause the fibrosis around the site of the wound, and that fibrosis lead on to decreased vascular supply to the site of the wound. Then is the renal disease. The renal disease basically cause hyperuricemia and increased level of creatinine. So hyperuricemia can also cause decreased immunity, depression of the immune cells and other various cellular elements, and the deposition of the collagen. So all these things which are required for the healthy healing and quick healing of the wound will be depressed in case of renal disease. Then patient on chemotherapy I have already discussed. Patient on radiotherapy I have already discussed. So these are the various factors that can cause the delayed wound healing. So if while examining the patient with delayed wound healing, if we find any factor that is present in the wound, So if we can decrease the effect of those factors, or we can, like the necrotic material is present, edema is present, tension is present, so these are the factors that we can manipulate, we can control. But like the malignant disease, diabetes mellitus, so these are the factors we can control to a certain extent. In case of diabetes, we can maintain the blood sugar level below 150 milligram of, so that blood sugar level, if is maintained within a normal range, that we can enhance the healing of the wound. So all these factors we have to think when we think that there is delayed healing, or the factors which are present that can affect the healing of the wound. Thank you very much.